My name is Vu and I love cigarette.
36-year-old Vu is addicted to cigarettes. He does nothing but smoke cigarettes morning, noon, and at night.
I smoke every day, breakfast, lunch, and dinner, and supper.
Each day, Vu smokes at least 1 pack a day. That is over 3,000 cigarettes consumed in less than a year.
I love cigarettes. It's soothing, it's tasty. I just love the smell of it.
Vu smokes everywhere. He smokes while he studies, he smokes while he uses the bathroom, he smokes everywhere.
I don't really care what anyone think about me. I'm just gonna smoke anywhere, whenever I want, when I feel like it.
Until one day...
Hi there, my name is Dr. Daniel.
And Vu?
What was your name?
Vu?
Vu, okay. So, what's wrong with you today?
I think I have lung cancer, doctor.
Lung cancer?
Yes.
So, what are your symptoms?
I cough a lot, sometimes with blood. My chest hurt a lot. Sometimes I have shortness of breath. My mucus changed in color and volume, and I lost my appetite. I couldn't eat anymore. I'm tired every day. I have a lot of headaches. My bones and my joint hurt. Bleeding, and my neck and my face swell sometimes.
Wow, that's a lot. Do you smoke a lot? Did you know that smoking a cigarette contains over 60 carcinogens? And that 87% of lung cancer is smoking related?
Oh man, I did not know that.
Do you have any family members that smoke?
Yes, my dad does.
For how long?
Since I was a kid, yes.
Did you know that secondhand smoke can increase your chance of lung cancer by 20 to 30%?
So how do I know I have lung cancer?
Alright, well, first thing we're going to do is that we're going to run some tests.
Okay.
So the first thing I need you to do is please stand up.
Okay.
Alright, please turn around real quick.
Okay.
And I need you to bend over.
Hey, I thought this is lung cancer.
Oh, I'm sorry. That's right. Just spin this cup right here.
Alright. Okay, so what's next, doctor?
Well, we're going to run some tests on this spit.
Okay.
And we'll see what you have, okay?
Perfect.
Alright, take care.
Alright, see you later.
Hey, Dr. Alex. What's up? I have a patient here. His name's Vu. He thinks he has lung cancer. Can you run some tests? I have some samples over here. And can you remind the audience how carcinogens affect DNA again?
Oh, I'm glad you asked. Follow me this way.
So as you know, cigarette smoke contains over 60 carcinogens. Usually in the body, these carcinogens are oxidized by an enzyme called cytochrome P450 to form an intermediate, ultimate carcinogen. These intermediates are affected by phase 2 enzymes and are helped excreted from the body. However, these intermediates can form DNA adducts, which can cause mutations, and if not repaired, can eventually lead to cancer. Hey Matt, you want to explain the 2 types of lung cancers to them?
I'd love to. Okay, so there are 2 types of lung cancers we look at the lab. First one is small cell carcinoma, the second is non-small cell carcinoma. Small cell carcinoma is primarily associated with smoking and is also called oat cell carcinoma because of the flat appearance of the cells and the distorted cytoplasm. Now, non-small cell carcinoma, there's 3 subcategories that we look at: adenocarcinoma, large cell carcinoma, and squamous cell carcinoma. So these are the 2 primary lung cancers that we tend to deal with in the lab.
Thanks, Matt.
No problem. All right, we got our sample, so let's just run a few tests and see what's wrong with our patient.
All right, sounds good.
All right.
Matt, the results are in! Catch!
I get these to Dr. Daniel immediately.
Alright, Vu. Why don't we go over some of the stages of cancer you could possibly have?
Alright.
All right, there's actually different stages of cancer you can have.
Okay.
Stage 1 is where the cancer is only spread in your lungs.
Okay.
Stage 2 is the cancer is in your lungs and the nearby lymph nodes. Stage 3, the cancer is in your lungs and the lymph nodes in your chest. And stage 4, the cancer is spread in both of your lungs and is spread to another part of your body.
Doctor, I have the results. You look at this.
All right, Vu,
Okay.
the results are in.
Awesome.
But before we go over these results, why don't we go over the possible treatments you can undergo? Follow me. Depending on whether you have small cell or non-small cell lung cancer and what stage you are, there are many treatments you can undergo. There are treatments such as surgery, radiation therapy, chemotherapy, and therapeutic drugs. Let's first talk about surgery. Now, depending on the size, location, and severity of the cancer, there are many surgeries you can undergo. There are surgeries such as a lobectomy, a wedge, a pneumonectomy, a segmentectomy, and radiofrequent ablations. Now, I won't go into detail about all these surgeries, but that's a perfect opportunity to ask during the Q&A. There actually are some side effects of surgery. Some side effects are chest pain, shortness of breath, and vocal issues. Alright, next we're going to talk about radiation therapy. Radiation therapy is the use of high-energy X-rays or other particles used to destroy cancer cells. The radiation destroys cancer cells directly in the path of its beam, but it can also damage normal cells. Usually, radiation therapy is not used to treat large areas of the body. Patients who undergo radiation therapy experience the following side effects, such as fatigue and loss of appetite. Alright, next we're going to talk about chemotherapy. Chemotherapy is used as a drug to destroy cancer cells, usually by stopping the cancer cell's ability to grow and divide. Chemotherapy has been known to improve the length and quality of a cancer patient. Chemotherapy drugs are known as etoposide, carboplatin, and irinotecan.
So, Dr. Daniel, can you explain to me what etoposide or whatever that medicine calls is?
That's an excellent question, Vu. Matt, would you like to explain what etoposide is?
I'd love to explain. Okay, so we could treat lung cancer by targeting its DNA regulatory mechanisms. One such mechanism is the unwinding process. To target the unwinding process, we use a drug known as etoposide. Now, etoposide targets topoisomerase 2. By targeting topoisomerase 2, it prevents the religation of the DNA after unwinding, which compromises the DNA and hopefully will kill the cancer.
There are many side effects to chemotherapy. Side effects such as fatigue, risk of infection, nausea, vomiting, hair loss, loss of appetite, and diarrhea. The next type of treatment we're going to be talking about is targeted therapy. Targeted therapy targets the cancer cell-specific gene, proteins, and tissues in the surrounding area that help contribute to cell growth and survival. This treatment helps block the ability to grow and to spread of cancer while limiting damage to healthy cells. Alright, the next therapeutic drug we're going to be talking about is Avastin. Avastin is an anti-angiogenesis drug that blocks angiogenesis. Angiogenesis is the formation of new blood vessels.
So, Dr. Daniel, what is angiogenesis?
Come on, Vu, weren't you listening in class? Alex, would you like to explain?
Thanks, Daniel. Angiogenesis is very important for cancer growth and persistence. So if we can target this, we may be able to slow it down. The obvious target in this strategy is VEGF receptor. If we inhibit the activators of angiogenesis, we can slow down the cancer and continue to treat it more effectively. One way we can do this is by using an antibody to VEGF, such as Avastin.
There are some side effects to Avastin. Rare side effects such as holes in your stomach, wounds that don't heal, serious bleeding, and severe high blood pressure. The next targeted therapeutic drug we're going to be talking about is Tarceva. Tarceva is a drug which is known to block the EGFR. This is known to work better than chemotherapy if there is a mutation in the EGFR gene.
So, Dr. Daniel, what is the Tarceva and how does it affect the EGFR pathway?
That is an excellent question, Vu. Actually, yo Alex, you mind taking that one for me, please?
One predominant factor in lung cancer is a dysregulation of the VEGFR pathway. This can occur through mutation, upregulation, truncation, or involvement with another molecule, such as HER2. We know EGFR is one of the overall upstream elements in proliferative signaling and functions of tyrosine kinase activity. We know it does this by forming a homodimer between two EGFR in order to self-phosphorylate and trigger a signaling cascade. As a result, I believe we should target this receptor as well as other downstream elements in order to treat the patient's cancer. One way we could do this is through drugs that inhibit the tyrosine kinase activity of EGFR, such as Tarceva.
The next targeted therapeutic drug I'm going to be talking about is crizotinib. Crizotinib works if there is a mutation in the ALK gene.
Dr. Daniel, last question. I'm taking biocancer right now, but I never heard of the ALK gene, so can you tell me what it is and what does it do?
Why sure, boo. Actually, ayo Matt, can you take that?
Well, sure, Daniel. We're aware that a chromosomal rearrangement involving ALK and EML4 can form a fusion gene resulting in increased kinase activity. This results in the transcription of anti-apoptotic proteins such as BCL2 and other proteins such as MYC and VEGF.
Alright, now that we talked about all those treatments, lung cancer patients usually combine treatments, such as they'll have chemotherapy before or after surgery, or they'll have radiation therapy before, during, or after. Alright, now that we talked about all these treatments, let's get back to Vu and see what he has.
Alright, Vu, I just read your results, and I'm sorry to say this, but you just have a sore throat. So I just recommend you, eating cough drops, Halls, Ricola, but I would recommend you that you stop smoking, okay? Are you going to smoke from now on?
No, doctor. Just gonna vape from now on.
Blah!